The bank is new in this arena, in the arena of health and climate change. We're relatively new, we're just about working for a year. We've found a community that's extremely active, extremely welcoming, and with very hard science and evidence, and striving to improve the knowledge, but also extremely collaborative and really a real can-do and let's work together attitude, which is extremely refreshing. And I have to say IRI, Columbia University, the Mailman School of Public Health are leaders in this area, both in the science, but also in convening these meetings and convening the different institutions and the different groups of people that around those themes.
My hope for the outcome of this meeting is that that the network of academic institutions, NGOs, and donors will work together in a way to build capacity in this field.
Well, I think one of the things that we need is to sustain the interaction. In the past, there's been individual research projects, there's been pilot projects, and there's been the work that's gone on the research side. And then you've got a whole separate track which is going on the policy and political side. So the fact that the climate change negotiations now talk more about health, or the international health negotiations talk more about climate. And then you've got mobilization of public opinion around climate change and health. And you've then got implementation in developing countries. All of those are all moving forward. Each of them has to be more sustained. It can't just be individual pilot projects, and they have to be joined up as well, because it helps the research community that there's a strong political mandate for health and climate change. But the political mandate can't move forward without the evidence, otherwise it all falls apart. The implementation also needs the evidence and the research as well, and the research needs the implementation to prove it's worthwhile.
I hope we continue the dialogue that we have initiated, and that we have already begun to identify areas and products that we can converge around, so that we continue, rather than just continue as a diffuse network, we begin to coalesce and we work together, every one of us with our comparative advantage and with our specific roles, to solve very specific problems.
We need to not only fund for the research on climate and health, but also bring that knowledge to practice, and to incorporate that into programming, into monitoring, into an evaluation. Considering climate, for example, when you're looking at a disease and you say, well, we were successful, if you didn't consider climate in those diseases that are affected by climate, then you may not arrive at the correct answer, because it could have been climate all along that caused your improvement or lack thereof. So that is what we're trying to get. Our participation here was precisely to start learning more about that, and how can we bring all of this to bear into our fields of work.
But I think the one thing that I think we are all here for is because we don't want to forget who our beneficiaries are. It's that one small person, boy or girl, that's sick, you know, and we'd like to be able to understand health and environment and climate change because of people that are actually needing us most out in the field.